Do you have a disease diagnosis that you just don't believe is true? Have you had that diagnosis for many years and all along you've felt like it's wrong and you've educated yourself and done your reading and you just don't think that the diagnosis is correct? Have you brought it up to your doctors and they've kind of poo-pooed it? Well, I would encourage you to continue to pursue a correct diagnosis because recent experience with patients with MS has shown me that misdiagnoses are not uncommon, at least as it regards multiple sclerosis. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. A misdiagnosed chronic disease is nothing to take lightly, especially considering it impacts your finances in terms of pre-existing conditions and things when you're applying for insurance coverage. Well, recently I've had two women with multiple sclerosis diagnoses that found out that they were misdiagnosed. One for 11 years and one for over 20 years had been misdiagnosed with multiple sclerosis. Now imagine that. They've been taking medications for a diagnosis that they haven't had all along. They've been overpaying for health insurance because of pre-existing conditions, and psychologically and emotionally they've believed or they've believed they've had a label, or they've maybe not believed the label but then still been stigmatized by a label for 11 and 20 years that wasn't even real. The patient that had been dealing with it for 11 years voiced to me that she had lost 11 years of her life because she had believed she had a diagnosis that she didn't have and had changed her life around because of it. So a misdiagnosis can be very costly. So I bring this video up today because I want you, if you have one of these diagnoses that you don't believe is true, do not settle for the doctors pushing you off. Healthcare is a free market like everything else. If you're not happy with the doctor or the hospital or whoever is treating you, then find someone else who will treat you the way you want to be treated and as thoroughly as you want to be treated. Because the one who loses if they're misdiagnosed is you. The doctor who misdiagnoses you goes on the next day with their patient load, et cetera, and they're not dealing with the disease themselves. So if you're struggling with a diagnosis that you don't believe is true and you don't feel like a thorough workup has been done to substantiate that diagnosis, or the diagnosis was given to you 20 years ago when our technology and our knowledge wasn't as good as it is now, then maybe it's time to reassess or reprove that diagnosis or accurately diagnose you and rescind that diagnosis. So again, if this is you, reach out to a practitioner who can help you get the answers you want.